Hello, welcome to CalDerm's Firefighter Screening webinar. I'm Sheila Johnston, Executive Director for CalDerm, and I'm honored to be joined here by our passionate volunteers and leaders in skin cancer awareness. For the first time in CalDerm history, along with our partners at the Firefighter Cancer Support Network, CalDerm, and the American Academy of Dermatology, we will be hosting a free cancer screening to firefighters in Truckee, at the Truckee Meadows Fire Protection District on August 20th and 21st of this month. And to help prepare our firefighters and our dermatologists for what will be a great event in preventing skin cancer, we have with us some amazing volunteers. We have Dr. Ann Haas from CalDerm, Scott Jenny from the Firefighter Cancer Support Network, and Kaylee Valenta. Before we dive in, I'd like each of them to introduce themselves and provide a little bit of background as to why they are here tonight. I'll start first with Dr. Haas.
I'm Ann Haas. I am a dermatologist who practices in Sacramento, California. I am on the board of directors of CalDerm, and I was the contact person through the American Academy of Dermatology to consider bringing the firefighter skin cancer screening project to the state level. And since I'm here in California, and since we have had a lot of wildfires here, and our firefighters deserve everything that we can give to them, I thought that this would be a great state to roll this program out. And I'm really happy to know that our pilot program is going to happen in Truckee Meadows.
Thank you, Dr. Haas. And Scott.
My name is Scott Jenny. I'm with the Firefighter Cancer Support Network. I'm the California State Director and the Director of Internal Training for the Firefighter Cancer Support Network. I'm a retired fire captain and paramedic with over 35 years of fire service experience. I've had a number of colleagues, that have been diagnosed with cancer, everything from occupational cancer, skin cancer, you name it, over the years. And that creates my passion for getting this out in the limelight. So I want to thank you for the collaboration of CalDerm, Dr. Haas and Sheila. You guys have been wonderful, as well as Kaylee. We've collaborated at a few different events, and it's been wonderful to get that the occupational cancer problem out in the limelight. So thank you for having me.
Of course. And Kaylee, welcome.
Yes, my name's Kaylee Valenta. I am a widow of firefighter paramedic Andy Valenta. He was a firefighter for the city of Vista in San Diego County for 11 years, and he passed away last year from stage 4 melanoma. He was only 33 years old when he died, and we have 2 little girls together. They're now 3 and 5, and they won't even remember their dad because of this. So that's where I come in. I'm also a melanoma survivor myself. And I have started a foundation in my husband's honor called the Andy Valenta Melanoma Foundation. And the goal of that is to provide skin checks to fire departments, hopefully starting in Southern California.
Well, thank you all so much for being here. I know between the 3 of you, you will provide a wealth of knowledge to hopefully prevent skin cancer from occurring in others, specifically firefighters. So I'm going to go ahead and dive into questions, and feel free to jump in. Dr. Haas, we'll start with you. Can you go ahead and tell us what the relationship is between dermatology and cancer? Why is this relationship so important in health?
Well, as it turns out, 1 in 5 Americans will get skin cancer at some point in their life. So dermatology is really on the forefront of diagnosing that, and we do a very good job at picking up skin cancer. Skin cancer is the most common cancer. It's more common than stomach and breast and colon. So this is something that every dermatologist deals with every day. And we now know that our firefighters have an increased incidence of melanoma, particularly in young firefighters ages 30 to 49. And that's a big deal for us, and that's a very scary deal. We know that melanoma is probably the most important cancer diagnosis that a dermatologist can pick up. So when we consider all of the cancers that firefighters can maybe get, a melanoma is something that can be reasonably easily and efficiently screened by dermatologists in health screenings at fire stations or community centers. We know that firefighters tend not to have dermatologists. And we also know that men in America have the highest risk of melanoma, and most firefighters, I would suspect, are probably male. So this is just one more service that the medical and surgical community of dermatologists would like to provide to our firefighters.
Thank you, Dr. Haas. And Scott, maybe you can expand on that, but why are firefighters more prone to skin cancer?
You know, we as firefighters have a 9% higher risk of being diagnosed with any type of occupational cancer, skin cancer being one of them, than the general public, as studied by the CDC and NIOSH results that were released in 2013 and then again updated in 2015. We also have a 14% higher chance of mortality than the general public. And it's because of all the different products of combustion, the polycyclic aromatic hydrocarbons, the particulates of the combustion that attach to our skin. We breathe it in, it absorbs through our skin, and then we ingest it sometimes when we're on scenes of large wildland fires, structure fires, vehicle fires, etc. So skin cancer is a very easily detectable cancer if we as firefighters just take that proactive stance, get ourselves checked. Early detection is the difference between survival and death from cancer. And if it's left unchecked and we don't do our due diligence because we think it's not going to happen to us, unfortunately, the end result it is, because the line of duty deaths in the fire service have rapidly approached 75% each year from occupational cancer, and skin cancer being one of them.
So that's a pretty disturbing statistic. Maybe you can share how the Firefighter Cancer Support Network comes in when that dreaded news of the C word comes in.
Absolutely. The Firefighter Cancer Support Network, we assist and support firefighters and EMS providers and their family members who are diagnosed with this insidious disease. We do two things for support. We offer what's called a signature toolbox. It's a big box that we deliver to your house free of charge. In this box, there's a number of resources available in there. Lots of different items from the American Cancer Society. There's file folders to organize all the mounting amounts of EOBs and paperwork that you're going to be getting from the various doctors you may be seeing. There's a business card holder in there to organize all the different doctors you may end up going to, because many of us who are diagnosed end up going to multiple doctors. But more importantly, the American Cancer Society has resources that we put in there. And then we have a manual called A Firefighter's Guide to Cancer Survivorship. That guide goes through everything you need to think about from the diagnosis through the journey of treatment and hopefully into remission. There's a place in there to journal what your doctor's telling you, because let's face it, when you get that diagnosis of cancer, you're overwhelmed. That's all you hear. And the patient doesn't understand anything else that's going on other than, I'm just diagnosed with cancer, and there's a possibility I might be passing away from it. So you take this to your primary care physician or your oncologist, and you document what they're telling you. In addition, there's questions in that manual to think about asking your physician. So it's a really valuable piece of information for the diagnosed to go through that journey. And then we also offer what's called a mentor. A mentor is a firefighter who's gone through the same or similar cancer that you're going through, or a caretaker who's gone through, such as Kaylee, whose husband's passed away, and could be a spouse mentor for somebody has passed away from cancer. And what they do is they guide them through or shepherd them through that process. It's a badge to badge peer support system. Let's face it, a lot of firefighters are used to giving all the service and all the help to anybody that asks. However, we're terrible at asking for assistance. And so, but if we speak to another firefighter, we're very comfortable with that. We speak the same language. So it really shepherds them through that process. And that's what the program was designed for. We also do free awareness education in the occupational cancer arena for any agency that asks for it. We'll come to your facility, we'll teach it through Zoom or Ring Central, that like we're doing right now. And we will give our training that is updated every single year to anybody that asks free of charge.
That's incredible. And I mean, Kaylee, you probably received all of this support from the Firefighter Cancer Support Network. Can you speak to the value of the network and how it helped you and your late husband as you were fighting cancer, and why families should be aware of this service?
Yeah, absolutely. So I can say they were on the ball. Within 48 hours of my husband's diagnosis, we were connected with the Firefighter Cancer Support Network. And they showed up with that box that Scott mentioned. And I still have the box. I have that guide that he mentioned, which is huge. And that's just one of the many things that are in that box. And that became our hub for all of the immense amount of documents that we got and needed to keep track of. So that was a huge help. And then the mentor that I was connected with was a widow herself, a firewife. And it was a very unique experience connecting with somebody who knew exactly what I was going through, with the fire aspect of it and also the cancer aspect and the fear. And they had kids, we have kids. It's pure chaos in the beginning. So having somebody to just sit there and listen and know what you're talking about, it's unique, and it's not something you can find anywhere else, really. So my husband and I were both so grateful that the Firefighter Cancer Support Network showed up at our door right away to help guide us through this process.
Thanks, Kaylee. Well, you mentioned, Scott, earlier about the statistics that firefighters are more prone to cancer just based on the sheer number of fires and wildfires now that are so incredibly prevalent in California. So as fire season continues to be, I think we might all agree, annual for firefighters, what can we do to bring heightened awareness to make sure that those fighting fires are aware of the risks involved?
Well, one of the things that I think to bring that heightened awareness, as you say, is what we're doing right now. One, having these screenings for firefighters just opens up a lot of all the different firefighters' eyes that, this is something that's not going away. In fact, it's getting worse. And the wildfire season is now becoming basically a year-long event. And in addition to all the other products of combustion that we're exposed to. So we as firefighters have to understand that these types of programs of changing our culture, changing our awareness, and changing our operations to protect ourselves. And part of that is the skin cancer screening, as well as an annual medical screening. We have a form on our website that was developed by a physician who was a Boston firefighter, Dr. Michael Hamrock, that we recommend that each firefighter takes to their primary care physician. There's a number of tests that we as firefighters need to do annually, including skin cancer checks at an earlier age than the general public, such as colonoscopies need to happen at age 40. And all this stuff needs to happen annually. We need to be to do our due diligence to ensure that if we do have something, it's caught early. And like I said before, that's the difference between, early detection means survival.
Well, screening, absolutely. That's why we're all here today. For those that have never gone through a screening or it's been a while, Dr. Haas, can you give us a little bit of a sneak preview of what's involved in a skin cancer screening?
Absolutely. Dermatologists have been doing skin cancer screenings for years. There has been a program set up through our national organization, the American Academy of Dermatology, that has all of the screening materials. I did screenings for skin cancer back when I was a resident, and we are actually going to be utilizing some of their tools in our screening program. So what will happen, the firefighter will come in and fill out a form. The form is in triplicate, and the form is produced by the American Academy of Dermatology. It isn't anything we ran off on our Xerox machine. There are some standard set questions about family history of skin cancer, that sort of thing. And then there is a little diagram at the end, which is where the skin cancer screener, the dermatologist, will be making some little marks. So once the form has been filled out, the firefighter will go into a quiet room and change. We even have paper undies for people who need a pair of undies to complete our screening. And the dermatologist will use a lighted hand mirror and just look at the skin surfaces. If there is something that the dermatologist feels is of concern, we will make a little mark on that sheet of paper and let the firefighter know that we have some concerns. The firefighter gets a copy of that sheet. A copy stays with the dermatologist who screened the individual, and a copy will go to the American Academy of Dermatology for the purpose of data and archival retrieval. At that point, if we have concerns, we will be giving the firefighters a list of community dermatologists. In the case of Truckee Meadows, there will be a list of dermatologists who practice in Truckee, Reno, and Carson City for any firefighter to go and access depending on insurance. Some dermatologists from a fire after a screening will actually see people without insurance. We all know that the Academy screenings and now the CalDerm screenings are done for the benefit of the community, in this case, our firefighting community. We recognize that people who attend these may or may not have insurance. And our job is simply to make sure that we pick up any skin cancer that happens to come across the screeners' rooms. So dermatologists are very generous with their time and expertise following one of these community skin cancer screenings. So it's very simple, very easy, it takes 5 minutes to do, it's painless. No needles are involved, just a light and a magnifier. And I think when Scott was talking about the sorts of things, the proactive sorts of things that can be done, this is so easy. It's so easy to do. We're going to try to make this program available to fire stations as they request. And I guess I would just say, please go do this, because it's no big deal. And we may pick up something that may make a huge difference to your life.
Thank you so much for explaining the screening, Dr. Haas. Sounds very easy and doable. Should skin cancer go undiagnosed, Scott, what does that look like for firefighters? What can that turn into? And maybe Dr. Haas, you can add to that as well.
Well, for firefighters, I mean, like any cancer, yeah, that skin cancer is going to turn into melanoma, as Kaylee's husband found out and Kaylee found out. And that's the worst type of skin cancer. And it can ultimately lead to someone's death as it metastasizes through the body. And again, I just have to reiterate, we as firefighters have to do our due diligence, and we have to get screened annually. We are considered what's called high-risk employees. It's so important. And as Dr. Haas says, it's painless. And it means the difference between survival or not.
There is also, there are many forms of skin cancer. Melanoma, of course, is the one that we are the most concerned about and seems to be an issue in our firefighters. But there is also non-melanoma skin cancer, and those are also picked up at skin cancer screenings, and those are easily treated. It's an outpatient office procedure if we pick up any of those. Very simple and very straightforward, and certainly no reason to let those get any bigger. Catch them, while we can, catch them when they're small, and take care of them very easily. Of course, it's the melanomas because they are the most serious, but we very often will pick up non-melanoma skin cancer as well and can get it treated early and simply.
And from your perspective, Kaylee, between the skin cancer screening and more care, how did you find that it was best to prepare for steps 2, steps 3, and so on?
Well, my husband's situation was unique where it was discovered at stage 4, which can happen. and that's the worst case scenario. So we couldn't prepare, unfortunately. He died 3.5 months after he was diagnosed. It was just horrible. And that could happen to anybody. That's why it's so important for this prevention, where this may have been caught earlier if he had a screening. We don't know. But sorry, even a year later, it still gets emotional. But bottom line is, don't wait. Just get it done, especially if you're at the screening and the doctor tells you this looks suspicious, go get it checked out. Please do it. I can't stress enough about doing that, because there are some skin cancers that are slow growing and you may have time. Others are extremely aggressive, like my husband's. It even surprised his oncologist how aggressive it was. So don't wait until, oh, I'll do it after fire season, I'm too busy right now, because it could be too late. Do it for your family if you're not going to do it for yourself, because our life is shattered because of this, and no one deserves to go through this. So please get it checked.
Kaylee, that was so beautifully said. And I'd like to now invite Scott and then Dr. Haas to also just stress from your vantage points why this skin cancer screening is not only historic, but also important. Scott?
This skin cancer screening project that we're doing in Truckee Meadows, it's very historic. This is the first time we've done this on the West Coast. It is going to be something I hope that takes off for any department that asks for it. But more importantly, starting to get that awareness out there in the fire service that this is so important to do. We as firefighters, again, I keep saying this, we have to do our due diligence. We have to realize that we're not invincible, and that we don't want to leave our family members behind and make them struggle without us because we didn't take the 10 minutes to get screened or to do an annual physical. It's so important. And this program is going to bring that to light, I think. I'm hopeful that it's going to take off. Other fire agencies are already asking about this program. So I think this is so important. This collaboration is historic, but also so important in the fire service. And again, collaborating with Dr. Haas and Sheila and CalDerm, thank you so much. This is so important. And Kaylee, sharing your story is going to change lives, as well as your nonprofit is going to save lives. Thank you so much.
Thank you, Scott. Dr. Haas.
Well, I think this is historic because this is not being done across the country. And this program started in Massachusetts, and the dermatologist there had a brother who was a firefighter who died of an occupational cancer. And when she started looking at the literature, she realized that there was not only increased incidence of cancer in firefighters, but also melanoma. And she knew that dermatologists could do something about that. So she started the program and took it to our national organization. And as I sat listening to her presentation, I thought, you know what? We have lots of fires here in California. We owe this to our firefighters. This is something that we can do. We can give back. And CalDerm is an organization that has the organizational capability of being able to roll this out. And we have lots of fabulous dermatologists, north and south, in this state. And I thought this would be the state to start the West Coast push for this program. So this is our pilot, and this is where we're going to start. And I think there's no reason to think that there's any reason why we can't roll this out to the rest of the state.
Well, beautifully said. Thank you so much, Dr. Haas, Scott, Kaylee. I can't thank you enough for letting me be a part of this great movement to change the way we provide care as an organization. And through your support, we'll be able to do that on August 20th and 21st at the Truckee Meadows Fire Protection District. We hope that anyone watching will get screened either with us or at their local health office. We are here to help. You can visit calderm.org for more information, or Scott at the Firefighter Cancer Support Network, or Kaylee and her nonprofit. Kaylee, do you have a website that you might be able to share?
I do. It's avmelanoma.org, or we also have an Instagram under avmelanoma.
Fantastic. Well, we're all in this together, and we can't wait for August 20th to come. Thank you all for your time today.
Thank you.
Thank you.